Um, Hi guys. I hope you remember me, Shakun, and I'm the co-founder for Tickle.live. And we have someone very special today. Again, Russell Stambaugh, our advisor and a great person. You all know that we all have something major happening across the world, a pandemic, so to say, coronavirus. And if you have been there on social media or have you been talking to people, there have been a lot of do's and don'ts about it. So we just thought that we should discuss for some time about what is its impact on sexuality, especially when we have been told and been suggested that we have to practice social distancing. So over to you, Russell. What do you think about social distancing and how will it impact sexuality?
Well, first of all, social distancing is the best possible strategy in a great many places where COVID 19 has broken containment. And public health authorities are very worried that their medical facilities will be overwhelmed by too many sick people. So the idea behind social distancing is if people interact less, the disease will spread less. And while people will still get infected, and some people will be very seriously infected, the really serious cases that challenge scarce medical resources won't be overwhelmed. But that danger also makes it seem like contact with other people is dangerous. And that's why social distancing is important to do. There is a danger in getting too close to other people. And of course, sexuality, which requires a certain amount of physical intimacy most of the time, is very greatly impacted by social distancing principles. Now, the best understanding we have right now about how COVID 19 transmits is through respiration. People breathe out the virus. The virus is in their saliva. It's in the air for very short distances, and it falls on things and it lasts for a while. And if you touch any of those things, or if any of the fluids that have COVID 19 get into your mouth or your nose, maybe your eyes, then you can become infected. The vast majority of cases are infected this way. So that means any kind of sexuality that you might do that gets you close enough where you'd be sharing saliva or sharing breath with somebody else, that is going to be a case where transmission would occur if either of you happens to be carrying the virus. That's scary. Even scarier is the fact that since very many people might be exposed to this virus but have not been tested to prove that they don't have it, lots of people carry the virus. And the virus has an incubation period between when you first are infected and when you start to see symptoms of being sick of about 14 days. So that means you could be contagious for a long time, feel perfectly fine, act normal, and somebody who had sex with you or talked to you and you managed to spray them with a little bit of saliva, it only takes a tiny, microscopic dot that has the virus in it to infect somebody, you could get sick. So people are being told to stay 6 feet away from one another.
Yeah.
Well, that means you can have the kind of sex with somebody else that you can have as long as the two of you stay within six feet away from each other. And that doesn't look like most people's idea of good sex. Who can blame them, right?
Yeah.
So that's scary. You don't know who. Now, that doesn't mean that it's unsafe to have sex with somebody who you've been living with continuously for a long time and you're already socially isolating yourself and nobody's sick. The chances that you're going to get infected in that situation are really low. But it does mean that you have the faintest idea. You have no basis for evaluating somebody who you meet brand new, who you just
Yeah.
met while you were out at a bar, while you were shopping, or whatever. And in a lot of places, you're not even supposed to be out at a bar. And people are too afraid to talk to you while they're out shopping anyway, so your chances of meeting anybody aren't very good. But nonetheless, if you don't know somebody's sexual pedigree and what it is that they've been doing, and they don't know who they've been exposed to, even if they didn't have sex with them, then they're not safe to have sex with, unless it's the kind of sex that just stays 6 feet apart.
And you've talked about RAC, that we should practice RAC. Would you care to explain more what RAC stands for, and why do you think that we should practice it?
Back in the good old days of sex education, before HIV and AIDS had been discovered, sex educators talked about the importance of having safe sex. But it wasn't very far into the 1980s when we discovered that really there isn't such a thing as safe sex. Even before HIV, you were in danger of getting the traditional sexually transmitted infections like gonorrhea or syphilis. Those were a danger. Even sex that didn't carry the risk of HIV wasn't entirely safe. In the late 1980s, people in the world of kink, or BDSM, which is bondage and discipline, sadism and masochism, dominance and submission, people who like to play kinky, recognized that the public saw their behavior as scary and dangerous. And so they started to develop ethics that would help teach people that what they're doing is nowhere near as dangerous and as scary as the public thought. And that theory about how to do safety in the BDSM community came to be known as RAC, or risk-aware consensual kink. Now, I'm going to recommend that we use risk-aware consensual sexual behavior. You don't have to be kinky to want to be careful and to decide how much risk you're willing to take, because some sexual behaviors are riskier than others. It's riskier to have sex without a condom than it is to have risk with a condom if you are afraid of pregnancy or sexually transmitted infections. So with respect to COVID-19, risk-aware consensual kink means looking at what the possible bad outcomes might be for you and other people, and deciding how much risk you're comfortable and what steps or what inconvenience or what struggle you're willing to go through to preserve your sexuality while managing those risks. You might think it's safe for you to have sex with somebody even though you're unprotected because you're young and you don't think that you're going to be that badly affected. And let's face it, about 70% of the people who get COVID-19 have a mild flu-like case of symptoms. Now, 20 to 30% of those people wind up having serious lung infections that give them lasting damage. And a smaller proportion of those people, especially ones who are already sick or vulnerable through immunological vulnerabilities or through respiratory troubles, die. So it's quite possible to die from this, and you don't have to just be an old person, but old people are more at risk. If you're comfortable with all those risks, then you might be willing to do things that somebody who is not comfortable with those risks can't do. I personally have respiratory issues left over from lung cancer treatment. So what's safe for me isn't the same thing as what's safe for you. I have to be a great deal more careful.
Yeah.
So risk-aware consensual kink means being very careful to understand what your risk is, and then being careful to understand what your partner's risks are and what their tolerance for risk is. And then you contract with the other person and say, the things we're going to do are only on this list of things that we both agree to. And you can trust me to act within your limits, and I'm going to trust you to act within my limits. And that way we're both contracting to be as safe as we need to be.
So if suppose we've never been in a monogamous relationship, and you know that this is like a time when we end up going on a lot of dating sites. What is your take on it? How or what should people do so that they can satisfy their sexual needs right now, especially when they can't go out and they can't be sexually as active as they would have been otherwise?
Now is a very unsafe time to start new sexual relationships with strangers. We're talking in some places like New York City, where The advice from public health officials is that you simply do not meet with new strange people. And if you do meet new strange people, you stay 6 feet away from them. So that does constitute a very big barrier to getting to know people well enough to want to go to bed with them for the first time. So, some things it may not be safe to do or much of an opportunity to do. But there are things that you can do sexually that don't involve getting that close.
Hmm.
You can do camming on and sexual sharing through video cameras. Lots of people do camming. People do phone sex. You can talk to each other extremely hot and masturbate. There's a whole field of electronically assisted sexual behavior using sex toys called teledildonics. I can have a controller in my hand and make a vibrator do things on my partner who's on the other side of the planet if we have mutually agreed and that partner trusts me to do something stimulating for them using that kind of electronic technology. So you can give people sensation, you can talk to them, you can look at them. Many of the things that we do to achieve intimacy face to face can be done electronically, and lots of things can't.
So you think that this is the time
Teledildonic.
to make changes, to get creative, to maybe
Well,
stretch yourself a bit more?
well, you have to, because even if you are having sex with the same partner you have always had partner with, and you're carefully buttoned down in your apartment and haven't gone out and seen anybody else, the fact that everybody else around you is afraid and that that this virus is going around and you're not seeing a lot of the friends you would ordinarily be with and what have you, that's a strain. It's a strain on everybody. It's a strain on you. It's a
Yeah.
strain on your partner. It's a strain on your friends. You may be missing your friends. Even if you are an introvert and you like not going out and doing a lot of stuff with other people, not being able to do it is different than being an introvert by choice.
Right.
So there are lots of losses, lots of sacrifices, and lots of adjustments.
So
And
Russell,
those things take work.
and there was something very interesting that I read. There was a tweet where this person was saying that this is the time to use sex toys, vibrators, and not having sex, even with your partner. What is your take on it? Because I believe that a lot of people have completely stopped having sex because they're scared. And I think that should be like a parting advice or suggestion or discussion before we just call it a day today.
Well, I agree. I think that sex is a kind of a trust fall, where I say I trust you enough to put a certain amount of my safety, my emotional safety, and in this case, my physical health safety in the hands of somebody else.
Yeah.
There are plenty of people who are living together with regular partners who don't have the kind of trust that those partners would be faithful to them or would take care of their emotional needs all that well, but they have sex with them anyway. And so to be in a risky situation like this puts a huge burden on those kinds of relationships. So, yes, it's perfectly fine to stop having sex with somebody if you don't trust them enough to be sure that you're not going to get the infection. Now, it's also an opportunity to talk to your partner and build that trust. Maybe your partner really deserves the trust and you're not being fair to them. But we're doing things that we took for granted, like we are on a high wire with no net.
Yeah.
And that is a big deal. So if you think that things mean differently today than they did just 3 weeks ago before you realized that everybody was going to be doing social distancing and you didn't even know for how long,
Mm-hmm.
you're right. Things are different. And you don't have to be too afraid to have sex. But part of the emotional labor involved in having a relationship, those costs have gone way up. And a lot of people are going to be anxious and depressed and challenged by that. It isn't necessarily that sexy to suddenly find that what you're doing is riskier than you thought it was.
Yeah. Very interesting and very sad situation that we all are in. Uh, Yeah. Do you have any parting words before we close this discussion?
Yeah, I do. And that is for all the negativity of suddenly finding that there are dangers out there that you didn't know were out there. Sex and intimacy are important. One of the things that we know from lots and lots of psychological studies is that people do best in the face of life challenges when they have strong social supports. And that means it's probably worth the effort to try to keep your social network together, including your sex life together, using means that are safe, that are available to you. Calling your friends, chatting with your friends, camming with your friends, using the people in your family who are with you in ways that you didn't necessarily use them before the virus came. Those are part of your personal resilience. And if you would like to know more about resilience, look up resilience at the American Psychological Association. They have a great description of resilience and coping strategies that work well when dealing with severe external challenges. And I also have a post on my blog, Elephant in the Hot Tub, that's about resilience, and I recommend that too, especially if you're kinky, because most of the examples I'm choosing are from the world of kink, where people are kind of used to challenging and want to go close to the edge, and where resilience is really important. But the COVID-19 has made resilience a much bigger deal for everybody, not just people who are sexual adventurers.
Thank you so much, Russell, for this. And I hope that this helps someone. And we should do it, sooner. But hopefully, things are going to get better sooner than later. And
Better now than never, and we can do
absolutely,
some more. There'll
yeah,
always be more to do, I promise you.
yeah. But thank you so much. See you soon.
Thank you.
Yeah. Bye.
Bye now, Shakun.